Okay, so hi everyone. Oh, my eyes look really bad. Let me put put my glasses on. So this is the first time I'm doing a YouTube video in reference to my there go look better. In reference to my hip labral tear surgery that I just had on Friday. So I don't want to make a long video. I just want to come around and bring some information, because when I was preparing to have my surgery and I was looking for information on YouTube, if anyone had had the hip labral tear surgery, I was, it was like very limited information. So I'm just going to jump in and get right to it. I was in a car accident in March, and me bracing for impact, I tore my, I sprained my rotator cuff in my shoulder, my left shoulder. But for the longest time, it was very hard to diagnose the hip labral tear. So I was in pain for like a long time. And then I was super scared, like when they were talking about, oh, you have to have surgery on your hip, possibly. Pretty much that was the only way to repair it. I was just like, nope, don't want to do it. Just like, I was thinking like, oh my gosh. And to know me to be thinking that way, it just was like really weird, because I'm normally the one that's encouraging everyone else. So anywho, I had the surgery, and it was through arthroscopic surgery. So it was less invasive, and the recovery has actually been extremely well. Like, just superseded all of my expectations. I went in that morning, Friday morning, and oh, what's today? Today is Tuesday. I'm sorry. So I was just like, wait a minute, what's today? Today is Tuesday. So I went into the outpatient ambulatory hospital. So my surgery was outpatient. I did take a walker. You could take crutches. And again, I'm just jumping straight into it. They read off what they were going to be doing. The anesthesiologist came and spoke with me. My doctor honestly really didn't tell me all that the surgery would entail, like step by step, detail to detail. He just did not. And again, a lot of mine was just basically me researching things on my own, trying to find out. So anyway, we prepped, and they put these little styrofoam booty things on my foot, on both feet actually, I'm sorry. And so I was just like, what is this? Because nobody told me about that. So I was like, what is this? But they were very comfortable. It was very warm to my feet. And they administered like a local medication through the IV, because I was just like extremely nervous. So they did that. And let's see. Then the anesthesiologist came and talked with me. He told me what he was going to do. They gave me a antibiotic right before the procedure. It made me really, really nauseated. Like, and so my body responded to that. I don't know if everyone receives the antibiotic right before they put you under, but they did. So again, my body responded to it in an unfavorable manner. And next thing you know, I was out. Like, I don't even remember like nothing else besides the doctor walking by the door. And they were like, oh, she's okay. She's just having a reaction from the antibiotic. And then, yeah, I was gone. So I woke up in recovery, and, they gave me some ginger ale. They asked me if I wanted crackers. My throat was super sore. I don't know why, but my throat, like right here, was really sore, swallowing, and it hurt all the way to my ears. So I don't know. But physically, oh my gosh, I am not in nearly where the pain was, where the tear was. Like, I don't have any pain in that area, like at all. They made 2 incisions on my upper thigh area, to go in and use the lap to take care of the tear and repair it, and take care of the cartilage and all. But yeah, the injury area, nothing. If anything, I have like just this little nagging pain at the injection site. But it's just achy from time to time. I will take achy anytime, any day compared to what I had actually been dealing with for 7 months. So, let's see. After that, I was discharged. Again, I was wheeled out in the wheelchair. Then when I got home, I started using the walker, and my doctor told me initially he thought and recommended no weight bearing for 6 weeks. But then after this procedure, he said that I could put 50% weight bearing on it, and it's been good. It's really been good. Like today, I am walking somewhat without my crutches from time to time. However, I am not overdoing it. I am not overdoing it because you just had surgery. So I have to take 2 aspirin a day so that the blood can help get back to clotting. I haven't taken my pain pill since yesterday. So that's a plus. And really and truthfully, I was taking it a little bit for the agging, the achiness, because the achiness can be a little bit, daunting, but not extremely. I use ice packs to that area where the incision has been, but that's it. I hope this video helps you out somewhat, because I saw one video that was directly related to what I was getting ready to experience, and yeah, it's been good. So I'm trying to think of anything else. I have 16 stairs in my home, so I have also been able to, even the day of surgery, I went upstairs that night, came back down the next morning. So if I can help eliminate fears, and I do know everybody's body is different, so my experience may be different from your experience, but I just thank God, because it's nowhere near the pain that I had worked myself up to thinking that it was going to be. So if that's all, then yeah, that's about it. I'll probably come back in a couple of days. I go to the doctor on Thursday to, see what he's going to say, and that's it. And yep, I went in an epidemic, like with this whole coronavirus thing going on. So I am a germaphobe, and I was just like, I don't want to have to do this. But I didn't want to continue to be in pain either. So that's the short version. If you have any questions, let me know. I apologize. I have like no makeup on, no lipstick on. I thought about wearing some tie-dye for it to be nice and bright and cheery, because, it's enough going on in this world for us to complain about. So this surgery is definitely not one that I will be complaining about. Like, if anything, I'm good. That's it. Just comment and leave your questions, and I'll try my best to answer them as best as I can. Okay. Have a great day, and ask questions. I'll tell anybody before any procedure, ask questions. I'm going to take a nap because it is kind of draining. I did have the surgery, but I find myself getting tired the more I walk around, just because, again, you're still healing. So have a great day. Thanks.